It's Notes from No More Hygiene. I'm Steve Anderson with Dr. Tommy Nabors. And today we are going to talk about your head and your heart and what your mouth has to do with that. I think we're going to talk about the American Heart Association. Is that right?
Yeah, absolutely. It's kind of interesting. The mouth kind of falls right between the head and the heart. And,
Thank you for that.
finally, at least they're connecting that, right? So we've got the American Heart Association, talking about the brain health. And
Really?
yeah, it's pretty interesting because, we always like to use literature that anyone can identify. When we're teaching hygiene, it's one thing to have scientific literature, but I think everybody would agree that information from the American Heart Association, has been really dependable, over the last several decades. And so the article came out yesterday, Monday, November the 1st, and the American Heart Association newsletter, and the sort of the title is "Could the Path to Better Brain Health Involve Better Mouth Care?" And as we've been talking about so much in the terms of dementia and Alzheimer's and infections and inflammation, this is just another article that kind of summarizes that for us.
So I think the thing that's interesting about this is the American Heart Association talking about brain health and oral health and the whole deal. There's an interesting quote that they talk about the precursor to brain problems and other health problems is, why don't you read that quote? I thought it was fascinating.
It's just interesting because, so many times we think that the disease itself, we have to wait on the symptom before we actually have the disease. And so many times, the diseases have been present so long and we've just not done anything about it because we didn't know about it. And then we have the heart attack or then we just, it seems like it's suddenly we have dementia. And I think what they're saying now is and I can read that. It says, but recent research reveals that problems in the mouth exist decades before chronic illness is actually.
How long?
Decades elsewhere. And so that would suggest that infections like gum disease could serve as a warning flag early.
Hello.
And when we talk about the other CDC, it's an organization we quote a lot, where adults over age 30 now, 50% of them have periodontal disease, which is a bone level infection, at age 30. So if that's at 30, it would make sense when you start tying in quotes like this, that by age 50, age 60, when these things have been going for 10, 20, 30 years, that all of a sudden we're starting to seeing effects of that in the brain and in heart health.
So I think that's one of the most significant things. Again, something else to talk to your patients about is what's going on here is really the warning sign, perhaps decades in advance, that if you take care of it now, you may be saving yourself a lot of heartache down the road. So,
no pun intended, right?
Exactly. No pun intended. So sounds like the American Heart Association's branching out.
That's right. And, and I won't read the article because, part of this is we'll send everyone the link that wants it. They're quoting studies that were in the Journal of Neuroinflammation, the Journal of Alzheimer's Disease, in this article. And they're talking, these are one is a 20-year research project. The other one is 26 years. So these aren't just limited, studies. They're quite fascinating when you look at it in totality. And so I'll kind of leave the details of that for the reader, but it's pretty awesome.
One of our favorite verbal skills is, when somebody says, well, it doesn't hurt, when referring to periodontal disease, well, it doesn't hurt.
Right.
And the response to that is, I'm always amazed that a problem this serious doesn't hurt until it's too late.
Right.
And in this case, I guess you could say it doesn't hurt until you don't even know you have a problem because you lost your mind.
Right. Very true, man. Very true.
Symptomatic decades before it shows up in other parts of the body. So we'll include a link to that, those references from the American Heart Association. One more thing that you can talk to your patients about. Knowing it is one thing, being able to deliver and have a protocol in your practice that effectively helps you cure disease, save lives, grow your practice. That's what the No More Hygiene program is all about. Dates and locations with this message. Thank you, Dr. Nabors, for your most insightful views on where we're headed with periodontal disease. And I'm going to keep my mind for today and go brush my teeth.
All right, sir.
Thanks for sharing.
All right, thank you.